Welcome to this episode of Family Practice. Tonight, treating tumors with a needle through the skin, robotic colon surgery, healthy holiday diet tips, healthy holiday gift ideals, and the Police Activities League is here. My first guest to start us off is Dr. Nasir Siddiqi, who is an interventional radiologist with Baptist Health. Welcome.
Thank you.
So, tell me, what is an interventional radiologist?
Put briefly, interventional radiologist is a doctor who practices interventional radiology, which can be summarized as use of imaging technology to perform minimally invasive surgeries. So using, for example, the latest technology in CT, ultrasound, MRI, and X-rays, it is possible to place fine catheters, needles, wires through the skin into a target organ that is diseased and use different modalities to fix the problem. So if, for example, someone has had a CT-guided biopsy or someone had a blocked blood vessel ballooned, they have experienced the marvel of interventional radiology.
Okay, so it's more than just doing a CAT scan or an X-ray and getting a reading. You actually do some treatments, or what I would call invasive treatments also, because you go into the body organ. Tell us some of the treatments that you do and some of the things that you treat.
So there is a broad scope of treatments that we can do. We also participate in making diagnosis. So for example, if someone has a little spot on the lung or liver and imaging is not able to diagnose this properly, or blood tests, they do not give a precise diagnosis, it is possible to use imaging modality like ultrasound or CT and place a fine needle across the skin into the target and then do tissue sampling, which can be examined in the lab to give a precise diagnosis. Another example would be we can use the same technology to place a needle that can apply energy in the form of electric current or heat or microwave, for example, to kill this target tumor without any significant harm to the tissues in the path of the needle or around the tumor. So very precise treatment. Ballooning of clogged arteries. Similarly, opening up of blocked veins. So it's a specialty which is a culmination of deep work of over a century in medicine, surgery, and imaging, and really has a wide spectrum of applications.
And you can treat different tumors, and one of them is renal cell cancer.
Correct.
Now there's a graphic we're going to put up here that has a picture, and tell us what you do and a little bit about that.
So this is the image on the left, which is grayscale, black and white, is a slice from a CT scan during a procedure called CT-guided cryoablation. So this is a patient with a tiny tumor in the kidney, and the options would be surgery with partial or complete removal of the kidney, or percutaneous image-guided cryoablation, where under CT guidance I can stick a skinny needle, which is going almost, on the right side of this image, straight down into the kidney, and then we can freeze the target tumor, which, for example, would be represented by that green dot on this schematic of the kidney and blood vessels on the right side. And then we can freeze this tumor to as low as -40 degrees Celsius using gases like argon. And what that does is, when the tissues are exposed to this low of a temperature, they cannot survive.
And that is much easier than having an open operation because the recovery time's a lot better.
That is very true. Not only that, it's a painless procedure. Most patients are able to walk home the evening of the procedure, and a very quick, short recovery with minimal symptoms.
Okay. Real quickly too, you mentioned you can embolize fibroids in women and maybe avoid hysterectomies.
Yes, that is another area of interest for interventional radiologists. A lot of females in the age group of 35 to 50 years have this problem of bleeding heavily with the periods, or bleeding nonstop, spotting, pelvic pain, pressure, having to wake up many times at night to go to the bathroom, all caused by a very common disease which is called fibroids of the uterus. So fibroids are benign tumors in 99.9% of the cases, and they are blood hungry. So just like we do heart catheterization, it is possible that an interventional radiologist can catheterize those tiny arteries feeding the fibroids and block those arteries with tiny plastic spheres. So what that does is starves these tumors to shrink, and many of them die.
And avoid the hysterectomy.
And avoid hysterectomy.
Thank you for coming in. That's great information. Interventional radiologist Dr. Siddiqui at Baptist Health. We'll be right back.